I have lived with my lung condition for the past 13 years. Presently, there's no cure or treatment for it.
I had complaints of pulling on my lungs, and it took doctors 4 years to diagnose my lung conditions.
Living with my condition is stressful and frustrating. Having to cope with the chronic coughing, shortness of breath, and chest tightness every day.
My experience in the ICU after a severe attack taught me both fragility and resilience.
I can't sleep well with persistent cough and wheezing. The haze and air pollution make it even worse, make it harder to breathe.
We have an unparalleled opportunity to achieve this through the National Medical Research Council's Open Fund Large Collaborative Grant. The program we have developed is called TARIPH, the Academic Respiratory Initiative for Pulmonary Health. This national program with international relevance includes 5 fully integrated and interdisciplinary themes. The unique features of our program is that it embeds patients throughout, from development to execution, and involves multi-institutional partners across Singapore and the world.
Team 1's main goal is to improve early detections of lung diseases, prevent them from getting worse, and support primary care doctors in managing asthma, especially with a focus on Asian patients. We will concentrate on understanding the early stages of lung diseases like COPD, which could help guide treatment and potentially stop the disease from progressing. The team will also explore simple blood tests that could enable primary care doctors to better manage mild to moderate asthma, including deciding when to adjust treatment for uncontrolled cases. Overall, we aim to increase awareness of chronic lung diseases with early detections, strengthen diagnostic tools for asthma in primary care, while also addressing complex issues like the side effect of steroid use.
The patients who come to intensive care are by definition suffering from life-threatening organ dysfunction. But one of the great things about being an intensive care doctor is we get to make most of those patients better, and nearly all of them go home. But what we've discovered in the last 20 years is that when they go home, they're still suffering with problems. We know that some people are struggling to do their finances, others are struggling to get dressed. And what we're trying to do with this research is, instead of emphasizing on what happens in the ICU, is to look at patients beyond ICU.
To address these challenges, Team 2 will closely examine the experiences of patients after they are discharged from the ICU. So we will identify the key factors that affect recovery. We also explore what can go wrong during the recovery period. Also, whether pre-existing health conditions will affect recovery. And we really believe that if we understand what drives recovery for ICU patients after discharge, it can help us to better develop interventions to help our patients get back to their previous quality of life.
Theme 3 is all about creating a bioresource for Singapore. Why is a bioresource important for each and every one of us? Well, during times of war, or perhaps the next pandemic, we will have this bioresource readily available to take those cells out, regrow them in the lab, and understand how these infections, viruses, or any other threat is responding in the lungs of Asian patients with lung disease, well before it affects those lungs. Importantly, this bioresource is valuable during peacetime. It can help us better diagnose and treat patients with Asian lung disease. How does it do that? We get individualized cell models, or lungs in a dish, that vary between the ethnicities and between the patients, that we can better understand how drugs which have been tested in non-Asian populations respond to in Asian patients.
Team 4 will look at the development of a tool for predicting the flare of asthma and COPD, integrating relevant environmental triggers to predict for a nationwide respiratory health alert system. This novel system will proactively warn patients about environmental factors that could trigger their lung health, thus allowing them to take preventive actions before symptoms worsen. With growing challenges posed by climate change, increase in air pollution, heat waves, and extreme weather events, individuals with respiratory conditions are particularly vulnerable to these changes. The Health Forecasting Alert System will utilize real-time data, such as air quality, temperature and humidity, and weather patterns to provide timely notifications to empower individuals to make informed decisions about their outdoor activities, medication management, and other lifestyle choices, which will help mitigate the impact of climatic conditions on their health.
Team 5 will investigate how various environmental factors, diet, and lifestyle contribute to the onset and progression of allergies and respiratory diseases. This is particularly relevant in Southeast Asia, where our tropical and humid climate creates unique conditions that can trigger or worsen allergic and respiratory symptoms. The team will also take a closer look at the role of Asian diets and lifestyle patterns in shaping respiratory and allergic disease outcomes. This research could lead to tailored recommendations on lifestyle, diet, and environmental interventions that can help prevent and better manage allergies and respiratory diseases, particularly for Asian populations living in our tropical environment.
Our 5 themes coalesce under the concept of prevention in collaboration with our patients and partners focused on lung disease in Asian patients. Through patient-centered research, we will bring about
deeper knowledge of lung diseases,
so I can live life to the fullest.
Insights for preventive measures,
so that I can spend more time with the community outside the hospital.
novel treatments focused on Asians.
So I can rest easy, knowing there is a solution for me.
Innovative technology,
so I can enjoy going out without worry.
Better understanding of how our Asian lifestyle affects lung disease and allergies.
So I can breathe better